Folks, welcome back to another episode of the I Am GPH podcast. Today, we're very excited to have Dr. Stephanie Cook, who is an associate professor here at NYU in social and behavioral sciences and biostatistics. She's also the director of the Attachment and Health Disparities Research Lab over here, which has a lot of demand that she was telling us about, and a lot more once you all listen to this episode as well. Her research focuses on how minority stressors impact mental and physical health, especially for young adults at the intersection of racial and sexual identities, and how close relationships can buffer these effects. Dr. Cook's work is paving the way for innovative interventions to reduce stress and improve health outcomes in marginalized communities. This is something we've all heard about. Stress is bad, stress is this, stress is that. But we're so excited to hear about it from you, Dr. Stephanie Cook. Welcome to the I Am GPH podcast.
Thank you so much for having me.
I'm curious to know, how does one even find a niche in stress? How does one even start that? What's your story, perhaps?
My journey really began because I knew that, stress and health was a crucial, topic just generally across multiple disciplines that affected multiple domains: work, school, home, society. And I think in my undergraduate work is when I first started to think more critically about what does stress look like across different populations. So as a Black woman or, as a Black man or a Hispanic man, like what does stress really look like? And then trying to understand, how stress processes contribute to health. And most importantly about my earlier work is that I was so interested in learning and understanding stress because I wanted to understand how features of close relationships, so how we connect, connect and make these loving bonds really can buffer the stress and health dynamic, right? And so I guess that's why I became so interested in stress and really dedicated my life to understanding and mechanistically understanding the process by which, minority stress or more social stress is associated with health. And then how kind of close relationships and like key features of the ways in which people relate kind of buffer the negative effects of stress on health.
You had an interest in the beginning and then you suddenly found like, okay, there's a lot happening here. I want to figure this out and I want to discover it.
Yeah.
If I was a 4-year-old right now, which at my heart sometimes I am, if I was a 4-year-old and I came to you that, Stephanie, I've been hearing about this word and everyone, all the adults around me use it. Mommy uses it, daddy uses it. What does this word stress even mean? How do you describe it to someone?
So you can describe it in a couple of ways. When we're thinking about perceived stress or the ways in which people kind of, talk about the stress they experience on a daily basis, we kind of call that kind of daily stress or daily stressors. And it's being anxious and sometimes getting physical symptoms like a rapid heartbeat and basically overall feeling overwhelmed by a particular instance of something. So job-related stress or exam-related stress, and kind of feeling those kind of overwhelming, anxious feelings around that. I am very interested in, too, kind of the physical symptoms related to stress, so stress physiology. So I talked a little bit about the rapid heartbeat, but we also study things like cortisol to basically understand the ways in which people's cortisol kind of spikes when they are introduced to a stressor. And so the way I always describe that process is, if you are on a hike and a bear comes into the pathway, right? And immediately when that bear comes into the pathway, your body will say, either I have to fight or I have to flee. And hopefully you all flee. But, that process of the speeding heart rate and the hormones that pump through your body to get you to be able to run really, really fast to get away from that bear, that is the physiological kind of stress process in action. So I always think about it, even though they're related, about these kind of two separate processes. So like the everyday daily stress where we're thinking about being overwhelmed or a little bit anxious, and then the physiological ramifications of that, or the acute stress process with the fight or flight. So if you are hiking and a bear comes into your path.
What is cortisol?
Cortisol is a hormone that is produced in this kind of fight or flight response. So this hormone is really, really protective, and historically, it is there to help us. So, if we are hiking and the bear comes into our path, we'll be able to run really, really fast because we'll have this boost of this hormone called cortisol. Unfortunately, what's happened over time is the introduction of chronic stress. So if you're constantly hiking and this bear is constantly in your path, then over and over, this stress system is activated and activated and activated. But then it becomes dysregulated. So it doesn't activate like it's supposed to at the level it's supposed to for you to get away from the bear, for example. And so we see this all the time when we're talking about chronic daily stress, or, one of the isms, racism, sexism, homophobia, as a chronic stressor that is constantly activating us. And then when we see that there's like what we call a blunting, or kind of a reduction in the value of the way in which this stress reactive system is supposed to occur.
What does the research say right now? What have you discovered in this whole research process? Because you have really got it down to this is what happens.
Yeah.
But then what are we noticing in the research in our world? What are you involved in right now?
In my work, I'm really trying to understand the ways in which these social stressors, minority stressors, so stigma, discrimination based on race, sexual orientation, or the intersection of these features is a chronic stressor that is experienced by marginalized populations. So what is my everyday level of stress? What do I, in a self-report nature, get really stressed out about? And then I want to connect that to stress physiology. If we want to push policy, and if we want to kind of show people that, Americans are stressed out, or marginalized populations are stressed out by certain features of our society, then we really need to tap into kind of that biological component and show that, there's dysregulated stress processes that are rampant in certain populations. And thus, we need to address that from a policy level. So I'll give you an example. So in some of my current work, I look at how social discrimination is associated with stress physiology. And so we do we follow people over time for 30 days, and we ask them every day questions related to stressors, life stressors, but also kind of like sleep, mental health, how they're doing. And at the same time, we collect biomarkers. So, in terms of, physical activity markers, sleep, and then also saliva to collect information on cortisol to kind of correlate how these kind of daily and then these chronic stressors are impacting in stress physiology, so impacting them internally. To be able to go back to policymakers and say, look, this is an issue, and we have to, really focus on these social protections or resilience features, boost social relationships and social cohesions, maybe, introduce programming to help people better connect with their neighborhood or their friends, build relationships and bonds, because, these might help kind of buffer the negative effects on social stress on a stress physiology.
What are these things like resilience features and things like that? These are new things we're hearing on the podcast. So I'd love to know more about it.
Resilience is one of those concepts. It depends on who you ask, but generally resilience is basically something that is developed within a person or they're born with, and it's something that helps them overcome difficult situations. So if I become, resilient to discrimination, technically clinically, it doesn't affect me the same way that it might a person who has not become resilient to that specific form of discrimination. So the important thing to know about resilience is that it's dynamic and very much different by different people and populations, but most importantly, is specific to a certain stressor. So I might be very resilient to sexism, but not very resilient to racism, for example, or resilient to certain forms of adverse childhood events, but not resilient to other ones. And so even though it's a really important concept, I think it's also a very difficult concept because of its specificity.
What are communities we should be looking at in this thing? What communities has the research gone to in this time? You're saying different communities, different situations, different resilience abilities and things like that. What's coming up when I ask that?
A lot of my work has to do with intersectionality. And that is because I think that in public health, we do a lot of work about population health. So we want to know rates of cancer in the entire United States. And then sometimes we'll say, rates of cancer are different by racial ethnic groups or by, gender groups. But what we don't know and what we don't have a lot of information on and what we don't seek to understand is differences by these intersections. So how is, for example, stress experienced? In my work, I'm most interested in how is stress experienced by different intersectional groups. So if you're a Hispanic gay man or like a Black man or like any of these different intersecting groups, how is stress experienced and how does it differentially impact your health, your mental health and well-being? Am I more sad? Am I more depressed? Because my experiences of this kind of social stressor are different in some way. And this is critically important because if you really dig down in the research literature, there's just not a lot. We don't have a lot of information that really speaks to these kind of what public health refers to as subpopulations of individuals. And if we don't have this information, then we can't build prevention interventions. We can't, support vulnerable populations, which is part of the charge of public health. And so in my work, I really, really focus on addressing disparities for individuals at these intersections.
There's this word you used earlier to get more understanding of it. I've been hearing it in the fitness community called biomarkers.
Yeah.
What is a biomarker? You said saliva. You said cortisol when they take the blood work or something. How does one do that?
So bio are the biological specimens, and markers are what they're markers of. So, for example, for cortisol, there's many different biological ways to collect cortisol. We can collect it through hair, through saliva, through blood. Some and fingernails in some ways are better than others, and then they tell us different things. And so that's the marker part. So, for example, when I'm interested in very, very chronic stress, so last 3 months stress, hair cortisol is actually pretty good because when we use hair as a biological marker, we actually have information on the last 3 months in terms of someone's stress level. When I'm interested in daily stress, I use cortisol because I'm interested in over the course of the day, how does someone's diurnal curve change? And I know you're going to ask me about diurnal. Everyone has these diurnal curves. So, in the morning when they wake up, they have a level of cortisol. Then 20 minutes after, it increases. And then somewhere between 20 and 45 minutes, it starts to decrease over the course of the day. And then it peters out at night. And that's just because at night, it goes all the way down and then it starts up again. And that is a measure of kind of this daily, we can look at daily changes in cortisol. And then we have, stress tests. So like in the lab, we can look like at acute reaction to a stressful event. So we give them participants a prime that is supposed to be stressful, and then we measure their cortisol level over a specific time frame and see how that's different between individuals or within individuals. So when I talk about bio, I'm talking about any biological specimen. And the marker is what is it tied to in terms of, what we're interested in understanding and the features of understanding it in that framework. So hair cortisol lasts 3 months versus stress reactivity, which is more so kind of the lab-based experiment.
I had a feeling that I would be stressed talking to you about this thing. But what's interesting is I'm not, because you have really simplified it for me. But I'm not stressed about this, but I'm curious, the ones that are experiencing the stress on a daily basis, how do we help them combat that? You mentioned a lot to going to Congress and presenting this data. What else can other people do as that thing is not going forward? What are some things you have noticed?
I feel as if the stress world, we have ebbs and flows. So 10 years ago, we had a huge uprising. The American Psychological Association released one of its last iteration of the stress survey. And I feel as if policymakers really paid attention to the ways in which young adults had increasing stress levels, which is something that I'm very concerned about, seeing that my work is with emerging adults, 18 to 29. Right now, I think that we're really in this phase where we are trying to understand what can we do, right? But I think what we can do depends on what kind of stress we're talking about. And so the kind of stressors I'm talking about, thinking about social stressors like stigma and discrimination, I feel like we have a couple of options. We can, tackle discrimination, for example, which is a harder project, or we can really build socio-emotional bonds and relationships. Because from the literature, we, on attachment or, socio-emotional bond formation, we know that healthy bond formation within communities, within families, and romantic partners is critically important as a buffer for multiple stressful contexts across people and across time. And in terms of just like basic other things people can do, a lot of the research is pointing towards mindfulness meditation practices, physical activity. So you might have friends, or you might be someone that when they get a little anxious or stressed out, they go for a run. So all of these things are really helpful in terms of kind of like the daily stressors. What we're running into is, with the climate change people, is if you live in an area where you can't take a run, what do you do, right? So I feel as if we have a list of things that can be done to reduce stress, depending on what kind of stress you're experiencing. But how do we make it so that, all people can participate in kind of all of these options, or all the options that might be best for them to reduce their stress? And I think that that's something that we need more advocacy around, and more people paying attention to, so we can kind of do this work together.
That's reassuring, yet like there's things we can do, but it's reassuring to know that it's been simplified in some way, and there are people doing it. Mm-hmm. Speaking of people that are doing it, the people that want to do it, the students here at NYU and the incoming students, someone random watching this podcast, not in NYU, how can someone get involved in this work? What should they expect when they're getting involved in work like this in their life?
So I think that, most individuals, have an understanding of stress kind of in the general popular sense. I think for NYU students, I think for anyone that's really interested in, stress as something to be studied, understood, and to intervene on, should really, maybe participate in a stress and health course, think about or, take some lessons in stress physiology, but more so just start to listen to some of these podcasts, for example, that specifically tackle issues of stress and how to deal with that stress. I know some of the students in my lab currently, the way in which they started to be interested in stress and then, came to work with me is by, doing mindfulness meditations. Because the first thing that those apps do is explain to you what stress is and how this app will help in addressing their level of stress, right? So I think the most important thing is to get a deeper understanding past the more popular interpretations of stress, about what stress is, what it can do, and then how we might address it.
What can you tell us for the students that are at NYU and coming in, or this might even go out 2 years later to those people? Can you tell us about your lab?
Yeah, so I run a very large, well-oiled, beautiful lab in which has multiple wonderful people. And all of our work is around minority stress and health. So I have a lot of different research projects, research studies that are primary data collection, meaning that like my team goes into the field and we collect data from individuals, and secondary projects around kind of minority stress and health related issues. And so this goes from, the 2024 election study that we have going on to kind of measure socio-political stress, all the way to really understanding how intersectional discrimination, so the intersection of, racial, homophobic, and sexist discrimination influence cardiometabolic health behavior, so drug use, physical activity, and sleep. So we have all of these different studies going on, and they kind of all are accounted for by this whole idea of stress and health. Yeah.
How can students get involved in the lab?
So on my website, which is hopefully somewhere.
Yeah, we link that in the description.
Yeah, there is a form on the last page. And if you fill it out, my project director constantly checks that. And we interview people on a rolling basis. Also, my team is always at the job fairs or the labs and initiative fairs, and you can connect with myself or someone from my team during that time.
What is there a kind of person you're looking for to be involved in this, or that it sounds like an interview process on a rolling basis. So what's the kind of individual you expect to be involved?
That's a great question. So part of my work is also to develop pathways. I'm the pathway director for the Anti-Racism Center here. And so there's an application process just because there's a lot of applicants, but I look for various sets of skills. So in my lab, I have a lot of undergraduate students who might be just entering the research area and just interested in how you collect data related to stress. And so, they might not have sophisticated analysis skills yet, but they're interested and driven, right? But then I also have postdocs who have worked in stress and health for a very long time. So I guess the most important feature for someone that ends up working in my lab is kind of the drive to really affect change and to really study stress and health and to develop in that field in a way that they can go out and change the world, because in public health, that's what we want to do.
Changing the world one step at a time.
Yeah.
Dr. Cook is a very busy individual, so we're going to end the podcast earlier. I know you can hear it for another hour, but we'll put all her information in the description. And Dr. Cook, thanks for being on the podcast today.
Thank you so much.
Take care, everybody. We'll see you in the next episode.